Hello, I'm Dr. Sevann Helo, a urologist specializing in male sexual function at the Mayo Clinic in Rochester, Minnesota. Our Mayo Clinic men's health team has created this video because we know that talking about sex can be a sensitive topic, but that it's an important part of your quality of life. Each year, 200,000 men will be diagnosed with prostate cancer. Prostate cancer is the most common cancer in men, as 12% of all men will be diagnosed with prostate cancer in their lifetime. Whether you were just diagnosed with prostate cancer and are considering your treatment options, or if you've already undergone treatment, this video will cover everything that you need to know about having sex after prostate cancer. I'll cover how common erectile dysfunction really is, what causes it, other sexual symptoms you can expect, and most importantly, all of the treatments for erectile dysfunction after prostate cancer. So what exactly is erectile dysfunction? Well, it's basically trouble getting or maintaining an erection. This can be due to poor blood flow to the penis, either due to clogged blood vessels, high cholesterol, high blood pressure, or diabetes. I describe this to patients as you can imagine if you can clog the blood vessels that go to your heart when you have a heart attack, imagine what happens to the vessels in the penis that are about 1/8 of the diameter as those vessels to your heart. They're very sensitive to changes in blood flow. You can also have trouble trapping blood within the penis. This is a condition referred to as venous leak. It is often due to conditions such as diabetes, obesity, peripheral vascular disease, high blood pressure, clogged blood vessels, and high cholesterol. Lastly, injury to the nerves that go to the penis will also cause erectile dysfunction. This happens in patients who have undergone treatment for prostate cancer or an enlarged prostate, surgeries or injuries that affect the pelvic area or spinal cord, Parkinson's disease, and multiple sclerosis. So how common is erectile dysfunction exactly? Well, by age 40, 40% of guys will have some difficulty getting an erection. By age 70, that number goes up to 70%. Even after a nerve-sparing prostatectomy, only 40 to 50% of patients will be back to their baseline function at 1 year. At 2 years, that number is 30 to 60%. After radiation therapy, whether you received brachytherapy or the seeds, 25 to 50% will have erectile dysfunction. And after external beam radiation, that number is closer to 50%. So erectile dysfunction after prostate surgery, this can occur if you had a non-nerve sparing procedure. But even if you had a nerve sparing procedure, the reason for this is because there could still be some direct trauma to those nerves. Those nerves may have been stretched at the time of surgery. The use of cautery or heating during surgery can also affect the nerve function. There may be decreased blood supply due to the surgery, and you can get inflammation afterwards that can affect the function of those nerves. Men who are in increased risk for erectile dysfunction after prostate cancer surgery include men who are older, men who had some degree of erectile dysfunction before surgery, men who have conditions like diabetes, high blood pressure, heart disease, men who are smokers, and those who are physically inactive. And lastly, there are certain medications that can also predispose you to this. So what else should you expect after your prostate cancer treatment? Well, one of the most common things is a dry orgasm. This means that you'll still get that sensation of an orgasm, but no fluid will come out when you ejaculate. This is due to the removal of two structures called the seminal vesicles that sit on either side of the prostate. And these are always removed at the time of surgery. So you can expect that even though you'll get that sensation of an orgasm, you may not ejaculate fluid, and this can be bothersome to some patients and take some getting used to. It's also very common that men feel like the length of their penis has shortened after surgery, and we'll talk about some of the things you can do to help preserve that penile length. You can also develop a condition called Peyronie's disease, which leads to penile curvature due to scar tissue within the penis. This can happen in up to 20% of men after prostatectomy. Lastly, you can have leakage of urine during sex or orgasm. This condition is referred to as climacturia. So you're never too old, and there's no age cutoff for when it's the right time to get back in the game. This is something that we refer to as penile rehab. It's basically physical therapy for the penis. There really is something to the use it or lose it phenomenon. So you may wonder, when is the right time to start penile rehab after surgery? Well, it's basically whenever you feel ready and when you're cleared by your doctor. It can be as soon as immediately after surgery, although most patients will start 1 to 3 months after surgery. And for those of you who may have had surgery or treatment a long time ago, I would say it's never too late to try. In the next series of slides, I'll talk to you about all the treatment options that we have available. I'll present them in order from least to most invasive, but keep in mind that you don't need to try them in any particular order. You should choose what fits best with your lifestyle and what you feel comfortable with. The first treatment option we'll discuss is medications. These are medications like Viagra, Cialis, Levitra, Stendra. These medications can be used on demand each time you want to have an erection, or some of them can be prescribed on a daily basis. Viagra and Cialis are the two most commonly prescribed medications, and they work very similarly. I tell patients that the comparison between Viagra and Cialis is like Sprite and 7-Up. They work similarly, but they have slightly different side effects. So neither one works better than another. Fortunately, both of these medications are generic, which means that they're very affordable. They should not cost more than $20 a month. The way you would take them is 30 to 60 minutes before you want to have sex. If you're taking them on a daily basis, you would take an additional dose right before you want to have sex. Some of the most common side effects for these drugs include headache, facial flushing, runny nose, and muscle aches. The dose for Viagra is either 20 milligrams daily or up to 100 milligrams on demand when you want to have sex. For Cialis, daily dosing is 5 milligrams daily or 20 milligrams on demand before sex. As I mentioned, both of these medications are generic, which means they're very affordable. The easiest way to check and see where you can get the best price is by using this website called goodrx.com. Using this website, you can type in the medication that you're looking for and then your zip code, which will pull up the prices for all the pharmacies in your area. Prices can vary significantly from $20 to $200, so you'll want to make sure that you're getting the best deal. Also keep in mind that most insurance companies will only give you a certain number of tablets for the month. That limit may be anywhere from 4 to 6 tablets. So most patients will purchase these medications out of pocket because the out-of-pocket cost is typically less than even your prescription copay. The next option we'll talk about is the vacuum erection device. This device can cost anywhere from $50 to $500. You certainly don't have to buy the most expensive device, but you do kind of get what you pay for, so make sure that you're getting a medical grade device. Some of the advantages of this include that it's not a medication, it's a one-time cost. There is some data that shows that it can improve your penile length, or at least help you retain length. You can also combine this with the pills to get a better response, but I like to think of it as physical therapy for the penis. If you're going to use it for that purpose after your prostate cancer surgery or treatment, what you'll do is you'll take a cylinder that goes over the penis and it's connected to either a manual pump or an electronic pump, as is shown in this picture. You'll turn it on and it will help get some blood flow into the penis, stretch those tissues out, and try to prevent scar tissue from forming inside. Some of the disadvantages of this treatment include that it's not covered by insurance, and a lot of patients say that it lacks romance and spontaneity. The next treatment we'll discuss is the Restorex device. This is really a penile stretching device. It costs $500. It's also not covered by insurance. It can help improve penile length in patients who are concerned with this. And it is good for men who have penile curvature or Peyronie's disease. It does not get blood flow into the penis like the vacuum erection device, so it will not treat erectile dysfunction, and it can be expensive. But it is a good option for guys who are concerned about length and ideally those men who have curvature. Next option we'll talk about is penile injections. These are injections that you'll inject directly into the penis. I know most people's eyes get wide every time you say the word injection and penis in the same sentence, but these injections are not painful, and most patients say that they can't even feel when that needle goes in. You will have to inject every time you want to have sex. The cost is typically $100 to $150 per month, which should get you anywhere from 5 to 8 doses. The advantages of this are that it works fairly quickly, ideally within 10 to 15 minutes. You don't get those side effects that you can get with the pills because it will bypass your digestive system. And the injections are much stronger than the pills. And that analogy of Viagra and Cialis being like Sprite and 7-Up, the injections are really like Sprite and vodka. They're significantly stronger. Some of the disadvantages of the injections are that they're not covered by insurance. They have to be kept refrigerated, which can be somewhat of a nuisance and difficult if you're traveling. You also have to purchase these from a compounding pharmacy, so you can't just purchase it from your local CVS or Walgreens. The expiration date for these medications, because they're compounded, is also quite tight, 30 to 45 days. Sometimes you can stretch that expiration date by freezing a couple syringes of the medication. Repeated injection can also lead to scar tissue formation within the penis. It's difficult to know if it's the injections themselves or if it's the fact that men with erectile dysfunction are more likely to develop that kind of scar tissue. Lastly, if these aren't dosed appropriately, you can get a prolonged painful erection, a term which is called priapism, which is a urologic emergency. Lastly, we'll discuss the penile implant. The penile implant is a device that's inserted inside of the penis. It consists of 2 cylinders in the penis, a pump in the scrotum, and what's called a reservoir, which typically sits either in the pelvis or underneath your belly muscles. Every time you want to have an erection, you will squeeze the pump that's in your scrotum. It will cause the penis to get hard. You'll have sex the way you normally do. Whatever sensation you have now is what you'll expect with the implant in place. And if you ejaculate now, you would ejaculate with the implant in place. The only difference is that when you're done, you'll hit the deflate button for the erection to go away. The advantages of this are that the penile implant works anytime you want, every time you want, for as long as you want. It's also covered by insurance, which makes it more cost-effective than some of those other treatment options over time. Some of the disadvantages of the implant are that it does require surgery, and it is irreversible. So once you choose the implant, you can never go back to any of those other treatments that we talked about. The good news is that you won't need to because the implant will work, but you do have to be ready to take this jump. Lastly, some of the risks, including infection and mechanical failure with the implant, are certainly things that you need to consider as well. At 5 years, 95% of devices are still working. At 10 years, 80% are still working, and at 15 years, 70% of devices are still working. Infection rates are less than 1% for non-diabetics and approximately 2 to 3% for men who have diabetes. So in summary, I know that prostate cancer is a life-changing event for any man, but you do not have to give up your sex life. You can get back in the game whenever you feel ready and you're cleared by your doctor to start penile rehab and consider some of the treatment options we discussed. Regardless of what your situation is, know that sex after prostate cancer is possible. I guarantee that we have something that'll work for you. It's just a matter of how invasive that treatment may have to be. Please feel free to visit our website, menshealth.mayoclinic.org, for more information, or call 507-538-3270 to make an appointment. Thank you for taking the time to watch this video. I hope that you found it helpful. I hope that you'll entrust the Mayo Clinic Men's Health team with your care. I'm Sevann Helo, and it's been my pleasure to help walk you through this prostate cancer journey. Thank you.